we are live. Welcome to Back Talks. Happy Wednesday, everyone. This is Dr. Sean McWilliams, and coming to you from the beautiful state of Georgia. So great to have you here. If this is your first time, welcome. We love having you here today. And what I want to make sure that when you leave in a few minutes, that you feel more empowered and more informed and more hopeful than you feel right now if you are dealing with bulging discs, herniated discs, or spinal stenosis, and you're a mom and you just can't be the mom that you want to be. So great to have you here. So if you've been with us, and if you have been with us, of course, welcome back. Another beautiful day here in Georgia. So what I've been doing is I've been answering some questions that my moms ask me all the time. So I've made a list of them, and we pick 2 or 3 of them every week and answer them for you. So let's get down to it. So one of the questions we are asked today is, should I see a specialist? And if so, what kind? Well, we're talking about back pain here, or neck pain, typically due to bulging discs or herniated discs or spinal stenosis or facet arthropathy. And there's a couple specialists you can go see. Obviously, you can go to your medical doctor. They're usually going to give you painkillers and anti-inflammatories, maybe send you to physical therapy. So that's one route that you can go. You can go see a generalist chiropractor. They might be able to help you as well, but when you're dealing with conditions like that, you're definitely going to want to see a specialist within your fields. So specialists, typically a lot of people will go see an orthopedic surgeon. I personally really don't recommend that on average. I'll tell you, I'm seeing more orthopedic surgeons doing more spinal surgeries who really aren't that good at it, just so you know, most of them. And doing way more invasive procedures than should be done in most circumstances, unless you're in an auto collision and you have your vertebrae are crushed, and you need that type of emergency care. If you have cancer in your spine, I'm not the guy to go to help you, unfortunately. If you have severe osteoporosis and your bone density is so weak that we can't do other things with you that are less invasive, again, that's when you want to go see some of these spine specialists. But I tell you, if you're going to go see a spine specialist, go to a neurosurgeon. They're the smartest guys. They have to learn how to do surgery on the brain, around the spinal cord and spine. And I'll tell you what, the amazing part is that if you go to most of your neurosurgeons, most of them don't want to do surgery on you. They know the outcomes of surgery. They know what happens after they do surgery on the spinal column, and it's not good in most cases in long term, and you wind up having more chronic issues or other issues because of the surgery, because of scar tissue. So, I like them though. So if you want to go see a surgeon, that's what you feel in your heart like you need to go do. You want to go see your neurosurgeons. And I'll tell you, a lot of neurosurgeons in the last decade started doing spinal decompression in their practice, or refer to specialists who are doing that because they know the success rate of it, and it's way higher than most spine surgeries, and it's not invasive at all. You don't have to worry about getting infected. You don't have to worry about getting worse unless you go to someone who doesn't know what they're doing. So you want to go see a specialist like that. If you want to do spinal decompression, you want a non-surgical approach to it, I highly recommend you find someone that is nationally certified in computerized spinal decompression if you're looking for a practitioner to go to. Or you can come and talk to me, and I can tell you about what Disc University is all about. And it is the approach that basically me trying to mirror myself to be able to come virtually to your home to help guide you in repairing your spine, and getting yourself feeling better and getting healthier from the inside out, and without you having to come see me. And so I've created an entire course just to do that we've worked really hard on, and it's really amazing. And I'll tell you, it's changing lives every day. So you want to do that. If you want to go to somebody in your community, you're going to want to go to someone who is nationally certified in spinal decompression, and not just one time. I have 6 national certifications in it from 2 different universities, because there's always new information out there, and you can't get all the information in one time. So you got to go back and back and back, and then you got to go back and work on people and help people and learn. And then, sometimes when they're not getting better, figure out why. And that's the experience of a really great doctors, they have that in-field experience, but they're going and getting continuing education. So you're going to want to do that. Other things you're going to want to do if someone says they do spinal decompression is you're going to want to go to someone, who's nationally certified more than once, ideally by at least the two major certification agencies as well. And the questions I always ask them is, when was the last time you had your table calibrated? Have you won any awards for your ability to help people in spinal decompression? Do you do pre and post MRIs of your patients, and for how long? What is your success rate? So those are some of the questions that I would be asking if I was going to see somebody. Okay, so I hope that helps you. And if you don't want to go through all that stuff and you still know that you would like to explore spinal decompression, then you can go to drshawnmcwilliams.com, and we have a course for you if you're dealing with your neck, or if your low back is bothering you, or if both. You can do them both as well. We have a combo course, and I virtually get to come to your home and help guide you and teach you how to use a spinal decompression unit, how to track it, how to hydrate yourself, how to make sure you're doing the proper nutrition to repair your joints and your discs as well. So, and a whole lot of other things that you're going to learn. And it's probably a $30,000 education, and at least, and also the piece of equipment. And you can do it for a fraction of that as well, just so you know, okay? We try to make it really affordable for people. So, that's when it comes down to specialists. So I like staying away from the orthos. They become very surgical happy these days. And unfortunately, if you're going to be their guinea pig, it's probably not going to go great for you. It might short term, but probably not long term. So either go to a nationally certified spine specialist like myself, find them, or you can go see a neurosurgeon as well. But, you know, surgery should always be a last option, and the neurosurgeons are going to tell you that stuff. Let's answer one more question for you. What are the chances of recurrence of further injury of your spine and discs? Well, that's a great question too. Remember, these are my mom sending these questions in for me. That's a great question, and the reason is because it's all dependent on what you do to try to fix your spine. You gotta remember, if you have surgery, they cut tissues. When they cut tissues, we have scar tissue that binds in and to repair itself. Just like if you cut your arm or your kid skins your knee, right? You know, and get oozy and you get a scab. Well, that same thing happens on the inside of our body, except that scar tissue stays there and slowly can wrap around nerve branches and around the facet joints and become another source of pain that you didn't even have prior. So you want to really watch your surgeries. If you're doing spinal decompression, you need to rest. Part of our program, the second video I have you watch tells you, and it teaches you, and if you have a significant other, I ask that you watch it together so you can understand what do you need to do and what do you need to stop doing, and give yourself permission to heal and rest. It's super important. Remember, discs have the least amount of blood supply to any tissue in the human body. After age 20, the sinovertebral artery withers away and dies. That is the main blood supply to the disc. So the disc can only get blood supply from the bone marrow inside here, the bone marrow, which is richly vascular. But the problem is that the channels, the little straws in a way to get the blood from in here through the end plate of the disc, the top and bottom of the disc into the disc, are not very big, especially if you have a lot of inflammation in your body. So you have to give it time for it to get in there. And the beautiful part is that spinal decompression creates a vacuum, or at least it really attempts to create a vacuum to help suck this material back in, but also to suck blood in from the bone marrow to get it into the disc so you can speed up healing and oxygen and nutrition. All right, so super, super important to do that. You know, my patients that have followed the plan where we tell them exactly what to do, what not to do, all right, after decompression, how long should you rest for, can you walk, can you work out, should you do this, should you that, have it all laid out for you in Disc University. The people that follow that usually are very, very successful and get back to a pain-free life and get back to being the moms that they want to be. The people that don't follow that usually have to come back and do the whole program again, and then they always say the same thing: I'm going to do exactly what you told me to do this time. So you want to make sure that you take time to rest. All right, so ask for permission. Well, you know, if you're going to ask for permission, I want you to ask permission from yourself, because that's the only person that needs to give you permission to rest and heal is you. So give yourself some grace. Give yourself permission to stop It's okay to lay on your back half of the day. You can ask for help. Your friends can come over. If you have a significant other, they can come over. And you know what? Your children want to help you as well. They want to help, especially when they see mom not feeling good, all right? They want you to feel better quickly. And so it's okay to ask. You do everything for them. They can give you some back. And you're going to be glad you did, because you're going to heal properly so that we never have to deal with this again, okay? Hey, if you are suffering with bulging discs or herniated discs, spinal pain, facet arthropathy, spinal stenosis, you don't know which direction to turn, you really don't want to have surgery, why don't you book a call with me? I'm doing it complimentary right now. Normally it's almost $200 to sit down with me for 20 minutes. I'm doing it complimentary right now, so please take advantage of it. You can go to booking.doctor, that's D-R-S-E-A-N, McWilliams.com, booking.drshawnmcwilliams.com, and you can look a little bit about what we do, the people that we've helped, and you can get on my calendar and let's sit down and hop on Zoom for 15-20 minutes. If you have images, I want you to send those to me. There will also be a form on there that you can fill out and you can tell me everything you've done so far. Are you using PMF, red light therapy, spinal decompression, chiropractic, physical therapy, PT, pain management, whatever the case? I want to know what you've gone through, and if it's not working for you, why, so that we can look at and look at you from a different angle and bring some hope into your life. And I don't care if you said that you've done it all. You haven't done it all until you talk to me, because I've had so many patients come and say, I've done it all. And the next thing you know, 4 weeks later, they're going like, oh my God, I feel amazing. And they were going to give up. Don't give up, all right? Book a call with me. I would love to help you. And if I'm the right person, I'll tell you, I'll give you recommendations. And if I'm not, I'll be honest with you and I'll tell you that maybe Disc University isn't the right fit for you, but I'm also going to tell you which direction to go, okay? So I love and appreciate you. I'm so glad you're here today. If you love this and this brought value to your life, I hope you will subscribe to our channel. I hope you'll share this with other people as well. People need to know this information. Don't hold it just to you. Share it with them, please. And you might save someone's life, and they might come back and say thank you, and you had no idea just because you shared it with them. And if you have questions, leave me a comment. But the best way is set up a call with me at booking.drshawnmcwilliams.com, and let's hop on a Zoom call and let's see what you're dealing with. Let's look at your MRI and your x-rays if you have those. And I guarantee I can shed some light on your situation for you and bring some hope in your life. All right. Hope you have an amazing day. Love and appreciate you. See you next Wednesday.